Let's take you here now. GCIS this week held a webinar on localizing the implementation of the National Strategic Plan to end gender-based violence and femicide, which will strengthen the fight against gender-based violence at local levels. The webinar provided an opportunity to discuss and demonstrate how the implementation of the National Strategic Plan to end gender-based violence and femicide collective through the 6 pillars directly impacts communities. Now, let's discuss this. We are now joined via Zoom by Candace Ludik of the Pillar 6 convener. Candace, thank you so much for your time. Perhaps before we start to look at just some of the strategic things that have come out of this webinar, talk to us about these 6 strategic pillars that you have formulated.
Fantastic. Thank you for having me. So the National Strategic Plan on Gender-Based Violence and Femicide divides the work into 6 thematic areas. Pillar 1 deals with accountability, coordination, and leadership. Pillar 2 deals with prevention and rebuilding social cohesion. Pillar 3 deals with justice, safety, and protection. Pillar 4 deals with response, care, support, and healing. Pillar 5 deals with economic power. And Pillar 6 deals with research and information management. And that is the pillar where I do most of my work.
How are you expecting to localize the National Strategic Plan? I understand you'll also be launching a 100-day challenge, and that will be launched in a few days. Talk to us about what localization then means in the fight against gender-based violence and femicide for South Africa.
Okay, fantastic. So in terms of localization, the 100-day challenges are one of the ways in which we are fast-tracking the localization of the NSP at municipal level. It's not the only way, but being that that is what we are about to launch, I think that's what I'm going to focus on for the purposes of this interview. So 100-day challenges are a model that are being piloted in the gender-based violence and femicide space, as I said, to fast-track the localization of implementation. So each of the 6 pillars are working in a different district and focusing on the particular issues faced in that district in relation to the outcomes outlined in the National Strategic Plan for that pillar. So shall I focus on Pillar 6, which I'm part of? I think that's what I'm going to do. So we're working in the Garden Route district, and we're working with, as you know, research and information management. But one of the outcomes for Pillar 6 is integrated data management, basically. So we're looking at the child sexual and related offences case ecosystem. And what we are aiming to do is to improve the flow of data between all the role players in that ecosystem to improve service delivery to victims, survivors, and their families.
You know, one of the comments that were made, as we start to look into, just some of the characteristics that are basically around gender-based violence in this country and how high, the statistics are currently, is that the perpetrators themselves of gender-based violence are getting younger by the day. What are some of the, what are some of the research that you are uncovering as you go about this framework and trying to make it, the implementation thereof, at least more impactful? I mean, just today we were reading a story about an 11-year-old girl who was raped and killed in Kimberley, and apparently the perpetrator also, has done the same crime to other young girls, and he himself is a very, very young perpetrator.
Yeah, unfortunately, there's no easy answer to that question. In terms of research being done, unfortunately, I'm not the best person to speak in depth about the research because the pillar I'm part of consists of researchers from various research houses, various academic institutions, and I am more involved on the project management front in terms of coordinating the efforts of all these role players. So I can speak to you broadly, but I can't really speak to you about very specific, up-to-date research. I would have to consult with my colleagues on that. As for the age of perpetrators becoming younger and younger and younger, that is obviously a concern. I know in the webinar, Praise Kambula from Pillar 3 spoke specifically about that issue within the context of the criminal justice system. So the short answer is that the only way that we're going to end these sort of crimes, gender-based violence and femicide, is by changing the way society views this problem and changing the way that people think about it. So currently, we seem to have difficulty holding perpetrators accountable for their actions. And I believe that this stems from the fact that very often the perpetrators of these crimes are well-loved community members and family members. So we struggle to reconcile that somebody who can do something so heinous can at the same time be so well-loved and respected. So I think we definitely need to look at the ways in which we hold perpetrators accountable for their actions and not really look at it as punitive, but rather restorative in a way, because at the end of the day, we've got such a high incidence of gender-based violence and femicide in this country. And the reality is that we can't possibly put all of those perpetrators into jail and keep them there. We need some kind of plan to heal our nation. Gender-based violence and femicide are simply a symptom of a profoundly sick society. And if we start dealing with the issue of healing our society, I believe that many of these issues will be resolved.
I agree with you that plan is definitely needed, especially if you start talking about perpetrators that are just 10 years old. I mean, in your report saying that in 2020, 2021, we saw a 22% increase in cases of rape perpetrated by children, and the youngest of those was 10 years old. Candace, I'm afraid that's all the time we have for this afternoon, but thank you so much for your time and for coming on to the program.
It's only a pleasure.